The Dr. Terri Show is presented by Evexias Health Solutions. Evexias Health Solutions is an emerging leader in the integrative medicine on a mission to positively impact people's lives through the transformation of healthcare. Evexias educates and trains practitioners on the new, innovative, integrative therapies that support a preventative care model that drives vitality as you age. You can learn more about Evexias Health Solutions and many of the healthcare topics we discuss on the Dr. Terri Show at Evexias.com. That's EVEXIAS.com, as well as find a provider near you. Now here's today's episode. Hey everybody, welcome back to the Dr. Terri Show. We are live in Puerto Rico. I love it here. I've been here all week and decided to end the week with doing some podcasts with some key influential medical doctors on the island. And today, I'm so excited you're going to join me with Dr. Michael Soler. Been working to improve the health of Puerto Rico's educators through the Federation of Teachers Health Plan. He has a phenomenal bio, which you can link in the description of the show. But I really am excited that you're joining us today. So let's join in the conversation. We're going to talk about GLP-1s, how they've kind of can be mismanaged, what to look for in a good clinician if you're going to go on the GLP-1 weight loss journey. And something not many people are talking about is utilizing GLP-1 receptor agonists to attack the obesity epidemic in our young children and our teenagers. So join us in the conversation. All right. Well, welcome, Dr. Soler, Michael Soler. So, I think it kind of goes without saying. We've talked a lot before the show, and I've learned a lot about you. But I think it's pretty obvious you're one of the leaders, if not the leader, in I think metabolic disease management. Probably, definitely on the island, but really probably in the States as well. Just looking at your background and your history, I mean, it's amazing work that you've done in this space. It's very much needed because the obesity epidemic, as we know, in this country is pretty terrible.
It is.
Especially in children. 10 years ago, we didn't hardly ever see type 2 diabetes in children. And now it's, what is it, 1 in 4, 1 in 5? I don't know the exact stat. You probably do. But just, I'd love to know, family practice physician by training, just a little background on how you got into this space. You're obviously passionate about it. So I just want to hear a little bit about that.
Yeah, that was something that nobody was looking at 25 years ago. I mean, weight loss and losing weight, it was mainly because of aesthetic reasons,
right,
or people trying to look better. But now, 15 years later, it's a completely different approach. I mean, whatever we do in terms of losing weight is because we are doing some preventive medicine. We are improving obviously our health, eliminating inflammation and other things. But the key reason behind all of this is also the metabolic phase of losing weight. That's
right.
The most important thing that we need to think about. So when we started, we were just, trying to make people losing weight along the way. We started seeing people improving their health, having more energy and all those things
right.
that we were dealing with. Improving people's health, has become something that is very important in terms of how you keep your well-being along your life.
Absolutely. Because, obviously, obesity and metabolic disease, metabolic syndrome, is tied to obviously long-term diabetes and cardiovascular disease and strokes. And then that can lead to a lot of debilitating problems and a lot of burden on the family and finances and multiple things. I think what I'm hearing you say, going beyond, just aesthetically, looking better, that's a huge part of it. But I would imagine with the success you've had, you've seen even patients be able to kind of come off of maybe some of their medications and reversing some disease. So talk a little bit about that.
Well, most of the patients that come to our clinics or they're doing our weight loss system, most of them are looking to lose weight because they are either suffering of high blood pressure,
Right.
diabetes, as we already mentioned, other inflammatory diseases, metabolic syndrome, hypothyroidism, which is something that we see in 50% of all of our patients in our clinic. So when we started building a way to lose weight and systematically have that patient into the system every single week, improving, losing weight, improving their health, we are seeing the patient feeling better.
Right.
Obviously,
Right.
we started thinking about these people will not need this medication
Absolutely.
any longer. So we started decreasing doses, eliminating some of those drugs that obviously are not doing well in the long run of many people. So that's part of the important thing about losing weight.
Right. And doing it with a system as, you said something very interesting that I want to talk about, and we're going to talk about what your approach is, this systematized program. And, I know a big part of what you do are the GLP-1 receptor agonists, and, you are a pioneer in, that space and been using it very, very long time, much longer than many, because before it became trendy. But I do want to talk about that. It's a popular topic. I've done shows on it with other physicians before, because there's a lot of ways that it can be and is being done wrong. And so, people, I think, have been prescribing it just like it's any other medication to prescribe, but it really is a lot more than that. So talk a little bit about the GLP-1 receptor agonist for those that are listening that probably have heard of them. They might not know how they work. But then some of the things that we're seeing and you're seeing, and I know I've seen in my clinic of people that are just getting them at random places and how that can be a detriment.
The most important thing about losing weight and using GLP-1s is that you have to look around and make sure that you're following or going to a place that has the track record with many patients
Correct.
doing things the correct way, and that people it's actually having good outcomes using GLP-1s. GLP-1s are part of a systematically way to lose weight. It's not the only alternative. When I say that, what I'm saying is that you can use GLP-1s, but you have to make sure that you supplement yourself. You have to make sure that you're dieting the proper way. In a structured, balanced dieting program.
Right.
And those are things very important to do, and obviously under medical supervision. Many places all over the place are using GLP-1s and not really qualified to provide that service to many patients. And that's where you see most of the people with side effects.
Correct. So talk a little bit about, first of all, just like high level for the audience that may not really understand, when we're talking about GLP-1s, we're talking about semaglutide, tirzepatide primarily. Those are the generic names. But how do they work?
Well, actually, what they do when we use GLP-1s, the very important thing about them is that they suppress your appetite, they slow your gastric emptying. In most patients, we have seen that the stomach size kind of shrinks. That's very important because we make sure that the patient is eating properly portionized portions of food. Let's put it that way. And that we make sure that the caloric intake is the proper one in order to metabolically spend more calories out of the body fat.
Nice. So when you're saying the proper calorie mix, you're talking about the proper amounts of carbohydrates versus fats versus proteins,
Correct.
That kind of thing. And
that's what we meant.
Leaning more towards less carbs, I would assume. Or,
well, actually,
how does that work?
Diet, in our case, the dieting program is 60% protein and 40% a mix of carbohydrates and vegetables and other mix of balanced foods.
Okay. Healthy fats, I guess, I would
Correct.
assume, in that as well. So you've talked about side effects, and this is a big thing, that I think doesn't get talked about enough. And we've seen it a lot in the media in the last, 6 months about, these medications causing a lot of muscle loss and things like that. So let's talk about some of the side effects. We're in a restaurant, so we're going to have some kids in the background, but that's okay. So talk about some of the side effects and then, ways that people could mitigate some of those?
Yeah, well, actually, when you don't use the right dose and you are only depending on GLP-1s without any supervision, let's put it that way, or you are not eating enough proteins and carbohydrates within that dieting program, you will have side effects, gastric side effects, mostly nausea and vomiting, because as the gastric emptying slows down, your gastric acid production continues the same for the first 48 to 72 hours. Yeah. And that's one of the problems that causes nausea and vomiting. Mm-hmm. If that happens to be the case, we usually prescribe or recommend to our patients to use a H2 blocker, mm-hmm. which is the best way to deal with it. And it will cease in the next few hours. So that's one of the things that we need to know about in order to face any potential, side effect. All these side effects, if they happen or they happen to be present in the patient, they are very, very temporarily.
Right.
And it's not something that is forever.
Right, right. And what are some, side effects that would be, or effects have you seen that would have you need to stop the GLP-1 for patients?
Well, there are some patients that are not tolerant at all of GLP-1s. Those are very, very few cases out of, probably 2 out of every 2,000 they are not, able to use GLP-1s whatsoever. Because of that, they are too sensitive to the receptors, and it's very difficult to deal with. No
matter how low the dose, right?
Correct. Yeah. So in that case, we don't use them, but it's very, very random that to happen. In our case, we don't see that many cases. As I said, probably every 1 of every 2,000, we might be facing some minor issues, but it's from our perspective, it's not an issue at all.
So, and what about the side effect of that we see with, with muscle loss? Is that a real problem?
Well,
are you seeing that?
It happens mostly when people are just only, as I mentioned before, depending on GLP-1s, that they are not dieting properly and they are just ceasing their appetite, going fasting for long period of time. Obviously, the muscle has to, protein has to come from somewhere.
That's right.
So that's what really happens. But when you do it, the thing using a completely structured dieting programs with the GLP-1, it is the perfect formula to lose weight because, you prevent losing muscle. At the same time, your caloric intake consistent of mainly 60%, as I mentioned before, protein. At least 60% of protein and 40% of all kind of other carbohydrates. You won't see that. It's something that we have been experiencing for the last probably 36 months, that when we do it in that particular approach, we don't see rhabdomyolysis, which is the condition that makes you lose muscle mass. So on the other hand, since most of the people that are within our system, we keep track of them every 2 weeks from the medical perspective, we are very closely tracking those particular points, how they are losing body fat, how they are keeping their muscle mass.
Right.
And obviously, if we have to do changes or make any adjust along the way, we are able to do it.
Yeah. Wow. That's nice. And so, you said something so important too, and this is such a key thing. I know I see, back home at my clinics is patients that have found, a telemedicine weight loss program, and, they do a telemedicine visit and then they just send them a prescription of a GLP-1. And those are the ones that seem to come to us and aren't having success or losing a lot of muscle, and then they start to look very aged in their face and, things like that. I can't emphasize enough, and I know you've said this, about getting in a program, not just somebody that's going to give a prescription.
Correct. We usually use telemedicine for those patients that are already in our program.
Already in the program.
They are far away, or it is more comfortable to do it that way, but we make sure that they visit us every 6 weeks. Once we see them in our clinics and we are completely sure that we are already on track with them in terms of what they need and what would be the plan for the next 5 weeks, we can do it that way. But there's a whole bunch of people that they think that they may go into the web and try to find the first website that
And the
will
cheapest.
provide and the cheapest. And people, honestly speaking, I mean, you are not knowing what you're doing.
Absolutely.
Because, there are a whole bunch of things out there that are not, I mean, you don't even know where it comes from.
Absolutely.
And it is sold as it is the original formula, and it comes with a quality control system that it will provide you some security, and does not happen to be the case.
That's so true. You know, just knowing and being in the pharmacy space, with my husband, and understanding how important it is to get your medication from a, FDA registered 503A pharmacy. Don't just online. I have some patients that come, well, I found it online for $150 for a vial. Why is yours more? I can tell you right now, if you found it for $150 a vial, I don't know. I can't tell you what's in that. Right? Would you agree with that? It's kind of.
Yeah, it is funny when I listen all kind of stories from people and people telling me about like they end up, or they wind up in our office because they have been shopping around for this type of things, and finally they never get any positive outcome. And we hear all kind of stories from these people, and finally they found the place. From our end, we are so happy to be dealing with you and your pharmaceutical company, because we found a place that complies with every single aspect that we are looking for in order to provide to our clientele in our clinics.
As safe. Yeah, I had a patient one time, her husband, who had, and I want to talk about this a little bit because this is coming up a lot with pancreatitis. And he had a chronic pancreatitis and went to somebody that kind of didn't really know what they were doing and got very inexpensive semaglutide. And he started having abdominal pain, didn't really do anything about it. And he actually ended up in the hospital with acute, and he actually passed away.
Yep.
And so,
very sad.
It's very sad. So it's really serious. You really need to be with somebody that understands.
It happens. And we have seen quite a few cases similar to that one. And these other places that we don't want to mention, but we want to make
people aware, right?
Exactly.
Yeah, exactly.
Awareness about it. If there is no physicians involved in the equation, a physician fully trained, don't go for it. Don't try to do things that are not within the books.
100%. And then, I've had patients that were on it from another clinician, and they were also simultaneously with their primary doctor on blood pressure medicine. Nobody's monitoring their blood pressure. Right. I had one patient that, kept passing out, couldn't figure it out, and he finally ended up in the emergency room. Well, his blood pressure was so low, he had lost 40 pounds, but nobody had altered his medication. So these are the things that I really want people to understand how important it is to get with a program.
Very important thing about titrating doses.
Yes.
It's very important to know that people think that GLP-1s, when we use it, without medical supervision, it's just to cease or suppress your appetite.
Yeah.
There are quite a few things that we need to take into consideration when we use them, how to titrate and come up with the right dose, and things like, hey, doctor, or they go to any of these places on the web, on a medical consult that I'm not completely sure who is on the other end of the conversation. I'm still hungry. After 5 days, they continue increasing their dose. And we have seen cases that when it's not used properly, they end up having intestinal necrosis and things like that we just mentioned. So the very good thing about having this conversation is that we want to get a message across to everyone out there.
Absolutely.
That GLP-1s are the great alternative in the market to use when you're losing weight, but you have to do it under medical supervision, find the right place to do it, and you'll see the perfect outcomes when you use them that way.
Yeah, absolutely. Moving on, another little part that I wanted to talk about was you mentioned supplementation as a key part. And I also know that you also utilize, you make sure patients are optimized on their hormones. Talk about how important those two things are in conjunction.
There are two other things in conjunction that we use under our system, medically speaking, with every single patient. when we losing weight, we are making sure that the patient is being completely supplemented with different vitamins, because the problem is not dieting anymore. The problem is a metabolic problem. And so we are dealing with 9 out of 10 patients have a metabolic problem, metabolic syndrome, fatty liver, and so on, many other things. So we need to make sure that we rehabilitate the metabolism of the body. We have to make sure that every single organ is provided with the right minerals, right nutrition, right vitamins in order to have that metabolic optimization up to a 100% level.
Absolutely.
In order to have permanent changes when you lose weight.
Right. And that's key too. That's key with hormone optimization, because like testosterone, for instance, is a metabolic hormone, right? So if you're low in that, which many, especially overweight men are, that's just so vitally important. If you were going to, what are a couple of the top nutrients that you see patients with metabolic issues deficient in? I know you're going to say magnesium.
Magnesium is one of them. Vitamin D3 is another one. It's the most common one. Obviously, B-complex deficiency of all kinds. But on the other side, we also think we have to think about the lipotropic amino acids that we have to increase their amount or levels in the bloodstream in order to metabolically encourage the body to use more fat initially when losing weight out of the body as part of the conversion of caloric energy or caloric expenditure out of the body fat. So that's very important. So that's what we have to supplement the body. I mean, the system has to be supplemented with different other minerals, vitamins. But the thing that I wanted to say is that there is an energy thing that we need to think about when we talk about metabolism. The cell works with ATP, which is a form that the mitochondria produces energy. So if we don't supplement the mitochondria, we can lose weight, but we will never get to a energy level where we call energetic optimization of the cell. We will not be able to keep changes along the way. I mean, for the long run.
Yeah, and I love that you talk about mitochondrial health. I've never heard anybody talk about that in this conversation. And the mitochondria, the powerhouse of the cell, it is everything. And I think that's a key missing. You touched on something so, like, you can tell I'm getting excited about this conversation because nobody's talking about it. But you touched on something so important, because I think it's an aspect of when people are losing weight like this and they feel so fatigued, the assumption has been, it's just your blood sugar's low because you're losing weight. But I think it has to do with mitochondrial energy. What are your thoughts?
You have to feed the cellular matrix in order to continue having those changes. And it's just like if you have a plant, you have to put some
fertilizer.
You have to put some vitamins. Let's put it that way. Our body works exactly the same. If you're 40 and on, you will have to be supplemented in every single way in order to improve your health, have your energetic levels at the mitochondrial level, and have your cellular matrix, which is the soil of all those cellular organelles, that they have to be obviously well fitted in order to have that metabolic changes. Everything starts in the mitochondria from my perspective.
100%. You mentioned also some of the amino acids that help with the fat breakdown, right? Do you supplement those things orally, or do you do a combination of injections? Or
usually we do both. We use the injectable form at the very beginning, and we use it consistently every 2 weeks. But at the same time, we have to make sure that we sustain those levels in order to continue having a progress with the patient. So we supplement the patient orally in order to keep the levels in the bloodstream good enough so the patient sees the changes, feel the energy, and we make sure that the body is well supplemented in that particular metabolic form.
Right. And the B vitamins, of course, can't be underscored too in that area.
Sure.
Last thing I want to talk about is something that's near and dear to my heart, and that is what's happening with our children not only in our country, which is the worst in our country, but even probably globally. And I've seen a couple of studies that have come out that have been utilizing GLP-1s in obese children that were over 14, and seeing some really good outcomes. I don't see a lot of pediatrics and family doctors using it yet, but you are. And so tell me about that.
Well, actually, we use them in some patients that are 15, maybe 14 years old, and they have to comply with a criteria in our protocol. But if we have a patient that is 14 years old, let's say, for instance, and he complies with the adult criteria in terms of weight, height, and other parameters that
Your adult size.
Exactly. Then we proceed to use them. And obviously under extremely close supervision.
Sure.
And so far we have treated probably 1,000 kids with GLP-1s. And we have seen out of the label, obviously, that we are using it, we have seen excellent results.
I mean, what a life changer for those kids who were facing a lifetime of metabolic syndrome and probably end up on insulin and down the road maybe losing kidneys and everything that comes along with that, right?
To be honest, that's what they are. I mean, that's the end of the road.
Yeah.
But when we do all these changes, we're making sure that these kids are very productive in school. They are not running behind the rest of the other peers.
Right.
And obviously their performance in every single aspect improves dramatically.
Absolutely.
And definitely there's when we do this with kids, to start off with, I mean, we have to know that 4 out of every 10 kids are complying with the criteria of overweight and obesity. So that's something that it continues to increase.
Statistic.
It is huge. Not here in Puerto Rico, which we are U.S. territory, but all over the states as well. It's basically the same. So those, when we think about treating that population in particular, we have to be aggressive because we need to, one way or the other, we need to avoid that crisis.
Absolutely.
So it is endemic all over the place.
Absolutely. And they end up on, what I call the pharma treadmill. They can't ever get off, right? When they start that young, it's very different than, starting the pharma treadmill when you're 50 years old. You're starting it when you're 15, 16, 17. And it's just impossible to get off. So having the opportunity to reverse these diseases at a young age and completely change their lifestyle is so important. I would imagine it's a family affair because often what I've seen, if the child is obese, it's usually the family as well. So how do you get everybody involved?
It has a social economic factor. It has, I'm not into the genetics. I would say that after 25 years doing bariatric medicine, I don't think that genes has to do that much into obesity and
maybe
overweight.
Epigenetic changes.
Exactly.
But,
And I mean, we have to think about many other angles, but these kids, I mean, most of the time that they suffer of this particular disease, because obesity is a disease. No, it is no longer a syndrome.
Right.
And obviously we have to think about family support, how the family habits obviously end up,
because they're not preparing their food. Somebody's preparing their food.
And a lot of fast foods. You have all these electronic games that are no longer as we used to be in the past, playing out in the streets until late at night within our neighborhoods. It's not happening anymore. Right. The world has changed. From that scenario, and no longer you see kids playing out in the streets. Very few, at least down here.
It's everywhere.
All those factors, has to do with this.
It's a complete lifestyle change.
Correct.
Not just for the kid, but for the whole family.
So my suggestion to parents is that we need to teach our kids to do some exercise. Put your kids into sports.
Yes.
We have to be moving all the time, and that's something that. It's got to be part of the new approach in the next few years.
Well, even in public school system, I don't know about here, but stateside, many of them are, the physical education classes are simply sitting around in a gym playing games, like not even physical games, or doing nothing physical. I remember in PE when I was a kid, just sweating because we had to do those pull-ups and all the push-ups, and I hated it so much. But we just kind of don't see that anymore.
Yeah.
Yeah.
Well, many things have changed. I mean, if you push a student to do something or nowadays in school, I mean,
it's pushed back.
You may be able to face a whole bunch of other things, but back in the past, I mean, we were pushed and obligated to do things, and what would say anything about it?
Absolutely. Well, I really appreciate you and all the work you're doing, really, just a pioneer. I'm excited to just continue to work with you. I know you've got some exciting things on the horizon. You have, I really believe, the top weight management clinic in probably the country for sure, maybe even the world. You guys see about 5,000, I guess, patients a month through your clinics, right? And that's significant. That's not small, small potatoes. So, you're changing lives, and I love what you're doing, and I just really appreciate your time here today.
Thank you very much.
You're welcome.